in about 2015, with a mayor who was very interested in doing something about the dilapidated property conditions that he was seeing, came together with some private foundations, some nonprofit organizations, including Neighborhood Preservation, Inc., and began to think about how we could have a better code enforcement system. And we've been making progress towards improving that system. I'm Steve Barlow. I live and work in Memphis, Tennessee. I direct a nonprofit organization called Neighborhood Preservation Incorporated, and I'm a part of the Memphis Health Impact Assessment team. The specific challenge that we're working on is what we can do with code enforcement to improve the quality of life of residents in rental housing in the city. The teams of people who go out and inspect and enforce these property standards are a really important group of people for the health, safety, and well-being of a community.
We're looking at very broadly how, number one, how they're already impacting health, how they're doing amazing work to help make sure that people are in safe and healthy homes, but then also being able to take a step back from all of the hard everyday work that folks are doing to look at the big picture and say, where are there gaps in what's happening? What are some easy ways that we could even more strategically target code enforcement processes and agencies towards improving people's health?
We decided to look at it through a health impact assessment framework. So this is relatively novel. Often times health impact assessments look at a particular property or a particular project or a very narrow specific policy. And we decided to apply this in a more kind of strategic policy context to say, let's not look at just one policy, but let's look at kind of a combination of policies around how to improve substandard housing, with the thought if these policies could be implemented in a more sort of coordinated, collaborative way, then the health benefits, the health outcomes would improve.
One of the outcomes that we'd love to see is more frequent, proactive inspections of aging rental housing, especially multifamily, so that we don't have to wait for someone to call, someone who's probably in a somewhat vulnerable situation. We wouldn't have to wait for them to call and ask for a code inspector and potentially put their living situation at risk because of bad relationships potentially with the landlord or with other nearby residents. We'd love for a more proactive approach that has health in mind as one of the key reasons that we're doing this.
We all need to be working together more, both in terms of different disciplines, speaking to each other and working together rather than in silos, but also just even within cities and topic areas, housing and health folks need to be talking together more, and different cities need to be talking together more, different types of people from different communities need to be talking more. And if we could just all kind of think of ourselves as all one big group rather than separate disciplines and separate topic areas and separate, public, private, nonprofit, that we could get so much more done.
I would say that it has really challenged my thinking around, race, equity, structural racism. Those were terms that you read about. The workshops really allowed us as individuals to explore that, as well as explore that kind of as a cohort and as a team.
Really having to be uncomfortable in the uncertainty with going into a project with the idea of letting the community and city and problems lead the whole project and approach, and having to shift and circle and go back and forth between qualitative and quantitative, and being very open to not thinking we know the questions and answers in advance has been very uncomfortable at times, but really great. And it's really changed the way that I think about all of my research now. And I really value community involvement and input in a much deeper way than I could have imagined starting this.
I'd see in a culture of health that everyone lives in really a safe and healthy neighborhood.
In a culture of health, I see a direct and seamless connection between healthcare providers and housing providers that doesn't even seem weird.
In a culture of health, I see everybody having access to high quality and affordable housing in neighborhoods, and everyone having equal access to opportunity, jobs, education, and health.